InsideVision is brought to you by New England College of Optometry.
Hello again, everyone, and welcome to Inside Vision. I'm Howard Purcell, and along with my cohort in crime, Alec Lilligren, we want to welcome you back again. This week's show, National Perspective, a closer look at the independent. We're so happy that you're joining us today, and we've really brought together, I think, a great crew from Vision Source to share with you a lot of really good information. But Eric and I wanted to just make a comment before we get started. You know, we've been discussing the ongoing challenges of COVID-19 now for 8 weeks, and we've really enjoyed it and hopefully brought to you some information that's been helpful. But today we struggle even more. We can't accept any level of racism, discrimination, or harassment in our society. It's up to each of us to make a difference. Take this time to reflect. Do something. Posting on your social media is great, but do something. We can all make a difference. Thank you, everybody. And with that, Eric, it's great to see you. I know you're on location out in Texas area. Tell us a little bit about where you are and what's been going on, my friend.
Yeah, Howard, it's great to reconnect, and thank you. But say that I'm at Lakeline Vision Source, just outside the Austin border and city limits. And what we have here is an incredible practice that has remained open throughout the COVID-19 challenge, with a skeleton crew handling serious issues for this community. It's an inspiring story. And later in the hour, I'm going to have an in-depth conversation with Dr. Laurie Sorrenson and Dr. Eric Hammond about how they handled this. So I'm looking forward to that.
We're looking forward to it as well, Eric. Thank you. And I know Dr. Sorenson, she's a quality practitioner who has helped so many of us when it comes to particularly the practice management side. So definitely looking forward to hearing about that. Perhaps, Eric, maybe you could share a little. I know you've been traveling around the country. The country is progressing in a very positive way, setting aside what we spoke about this earlier, but at least from the standpoint of the business side. And, you know, we talked on earlier shows about this whole balance between if you will, health and wealth, right? The safety of our people with the generation of revenue. And have you noticed regional differences? How does Austin compare to some of the places you've been?
Well, it's really interesting. As I've been noting all along, the variation in openness is glaring everywhere you go. And I mean, it could be from town to town or block to block. And it varies in restaurants, it varies in hotels, it varies in eye care. And yes, there is that balance between doing business and staying safe, and it seems like the perspectives are just as extreme as they could be. It seems everybody wants to get back to work. A lot of my information about what's happening in the world comes from Uber drivers. I've been Ubers a lot, so I get to learn from Uber drivers about what their passengers are saying and about what the tones are in these particular neighborhoods or cities or towns. Austin, last night, I spent some time with our crew walking around downtown. Very limited options as far as food and, you know, obviously entertainment or anything like that. There's nothing going on, although things are allowed to be open. Southwest Florida, very open. Southeast Florida, not as much. South Georgia, very open. And, you know, just the attitudes and information varies throughout. So I'll be looking forward to filing reports about all these places in the coming days, and we'll keep stuff posted on Inside Vision.
Yeah, thanks, Eric. We appreciate that. By the way, just one more question on that one. You explained, and I think very well, and you've even shown us some of it, these inconsistencies. But as you've now visited optometric practices, are you seeing consistencies there in terms of what people are doing, how they're preparing, how they're protecting their staff, their doctors, their patients? Are you seeing consistencies there?
Certainly. The consistencies are that the workflow needs to be managed. Prior education of the patient base is critical to having a smooth workflow once that patient base is returning to the practice. And I think practitioners, one and all, are grappling with those issues in their different states and respective guidelines that they have to work with. But in general, what you see that is, a constant throughout is the need for cleanliness, the need for patients to feel comfortable.
Yep. I think we may have lost you, Eric, there. We lost our feed, but we'll come back to you in just a second there.
They lost us.
Can we hear it? No, we got you now. You're back now,
okay.
Eric.
Back. Okay. Well,
Yep.
I think I was saying that the number one consistency is that patients need to feel comfortable and doctors and staff need to feel comfortable with them. And if there's one thing that I can illuminate on that, it's that mutual respect of one another's perspectives on what it means to be safe or what it means to be cared for is of utmost importance.
Wow, pretty powerful and profound statement in so many ways, but thank you. So perfect lead-in probably to introduce our guests. I mean, the reality is we intend to be in optometry so isolated in so many cases, but having a network, having an alliance that we can be a part of seems to me at this point in time, perhaps even more important than it's been historically. And so we have a perfect group of people to join us this morning to talk a little bit about that, our friends from Vision Source. So why don't we bring those guys in and say a quick hello to them this morning. Good morning, everyone, friends from Vision Source. It's so great to see you guys. Thanks for spending some time with us. I want to just quickly introduce Donna Mikulecky. Donna is the Chief Finance and Vendor Relations Officer. Hi, Donna. Welcome. Good to see you in your bright red, cheering us up this morning. Joining Donna and sitting socially distant from her, appropriately so, is Jeff Duncan, the General Manager of Vision Source. I've had the pleasure of working with Jeff in my prior life. He's a quality guy who I know is in it for all the right reasons and trying to help Vision Source and its members continue to grow and develop. And then also my good friend, Dr. Amir Khoshnevis. Amir, welcome. Good to have you from Charlotte. Looking forward to hearing what's happening with you and your practice and all the great work you continue to do. Amir, you out there? Can we hear you? Say hello.
Yes. Good morning, Howard. Thank you for having us.
Thank you very much, Amir. So, Eric, if you're okay, I think I'm just going to throw it to these guys, and maybe we'll let Donna start. Donna, everybody appreciates the incredible value that Vision Source brings. Alliances have been so critically important to our profession, and Vision Source really the leader when it comes to that. But I think I'm interested in knowing, in its time of recovery, it seems to me that being part of an alliance like Vision Source even becomes more important. Can you speak to that and how Vision Source has supported its doctors during this very difficult time for all of us?
Yes. Hey, Howard, thank you. We started obviously way back when the crisis started, and it has been a major team effort. It's been a full-on effort from all of us to support our members, from helping our members with delaying some of their royalty payments, for securing PPE for them, developing complete resources on our website. Early on, it was called the COVID resource page. And now as we are opening up practices, it's migrated to the PARC, or the Practice Acceleration Recovery Center. And here we host a myriad of resources, tools, everything available for our members. Our members are sharing best practices, for example, that we also post on this site. We have regular video, regular webinars we're hosting for our members that started at the very onset of the crisis. And we host webinars a couple times a week that help them from everything from financial related items to safety items to opening your practice back up. Some are doctor related, some are staff related. So we continue, and it just continues to build, and we keep adding to these resource pages to ensure that the needs of our members are being met during these times. And as you might imagine, the needs have changed, right? And so as the needs continue to change, we continue to monitor that. It's just like you also mentioned, Howard, at the very onset, they're also facing new issues today as they started to open their practices. With the things happening out there right now, how do we help them even through the latest challenges that's facing our nation as a whole? So those are high level. I know Jeff and Amir have done a myriad of work on this as well. So I'll let them add in any additional kind of thoughts and comments they might have.
Yeah, I mean, before we hear from Jeff, I just want to quickly add that it seems to me the things that you're doing are wonderful, but just the fact of being part of a bigger entity, I know that's always been a strength of Vision Source, but just today, even more so, being out there on your own with all that's going on just seems so difficult for optometrists, and I think being part of your organization. So Jeff, maybe if you wouldn't mind, Jeff, could you just address how is the group doing? How are our Vision Source doctors doing right now amidst this? I know you guys are supporting and helping in a big way, but can you give us some sense, and then perhaps Amir can give us a little bit from the ground, but how overall, I mean, you're national, you're all over, there's so much differences from one place to another. How are the Vision Source members doing through all of this?
Yeah, those that know Vision Source and have been close to it know it's a positive group of people, right? And it's an optimistic group of people, and that's how we're wired. That's how our doctors are wired. And so there's certain optimism, but I'd be naive to say there's not concern and there's not, what's the future look like and how's this going to change, my practice and optometry in general. But they're forging ahead, and our members are obviously, doing it the right way. They're safe. They're taking care of their patients. But I think we honestly and confidently believe the future remains extremely bright.
Well, that's encouraging to hear for sure. When you hear from your members, and maybe either you or Donna can address this, and then we'll go over to Amir. But what are their biggest questions right now? What are you hearing? What are the biggest concerns? I suspect they're consistent for most of us, but just curious as you have a chance to aggregate some of this. What are the key elements you're hearing from the field?
Yeah, I mean, it's Amir. I'll let you jump in here too, but the concerns changed obviously as we evolved through this situation. Early on, it was how do I become part of the PPP program and ensure I'm going to get the small business loans, and how am I going to get that forgiven, and then how am I going to be able to secure PPE and be able to safely interact with patients. And so the needs, as Donna alluded to, they change very quickly and rapidly, and they evolve through the process. And I think right now, what folks like Amir are facing, and I'll let him speak to it, is just what is the new flow, and what is the way I can interact with my patients in a safe manner, but yet meet the financial obligations of my business and my staff and find that right sweet spot and balance.
Yeah, so Amir, we'd love to hear from you on that. Just one more comment I would make. I would think that for patients, and I'd love for you to comment on this, I think for patients, seeing the Vision Source sign and knowing that there's consistencies there and knowing they're going to see the appropriate protection, the appropriate things going on, for me, has to make patients feel more confident, because we can open up and be ready. But if patients aren't feeling comfortable and at least we're trying our best to minimize the risk, then we're going to have a difficult time. So can you talk to us a little bit about in the trenches, what's going on out there? What are you seeing? And then perhaps you could also allude to how has Vision Source adapted to this? So please, Amir.
Absolutely. Thanks, Howard. I think that the most important thing to note is that our organization was founded on principles such as the strength of optometrists coming together and sharing ideas and being able to build something that was based on best practices. From the very beginning, culturally speaking, that's where we were. We built an entire infrastructure of folks in the field who would then make sure that those members are taken care of, that if they weren't within the herd, that we would make sure they were brought in so that they would take advantage of all that we have to offer. So building on that, what happened was we immediately converted our systems and processes to one of member support, as opposed to sharing the best businesses and practices and the services and the products that we serve. We converted to being very member-centric in listening, adapting, and delivering what they needed at the moment of crisis. Having practiced myself in Charlotte, North Carolina, I can tell you there was a moment of panic followed by, I have a collective that I can reach out to. So what we did was we created the opportunity for folks to get together and reminded them that our community would help each other. And I can give you example after example of how doctors help a doctor go to sleep at night, knowing that if they're on their own, they would never have that difficult question answered. But because they could post it on our various channels where doctors are communicating, they're able to get that answer very quickly, and many were able to be consultants to each other. So the first thing I would say to you when it comes to community is that it's safety in numbers when it comes to Vision Source. Our doctors feel very secure and they get their questions answered very quickly. Now, to your second part about, what does it feel like in the trenches? I will tell you that while I oversee the entire network of doctors, what I face is the exact same thing they're facing. So it's nice to be relevant and nice to be in practice and know that I have concerns about my staff's safety. I have concerns about what if they were to get infected and how would we manage that? I have concerns about money and cash flow and how are we going to survive over the next 2 months. But what's great is that we're able to tap into the minds of Laurie and Mick and all of the great doctors in our network. We're able to give them the floor and they can do the research and come back to us on a weekly basis on webinars and give us the most up-to-date information. And I kid you not, every time I get off one of those webinars, I know that we're going to be okay. I have the answers I need.
Wow, that's
Amir,
pretty powerful.
Can I follow up on that? Would you mind if I followed up on that, Howard?
Please go ahead, Eric.
Amir, been in touch with Vision Source practices for many years, and you and I even did some video production work 8 or 10 years ago, I would say. And when you reference the Vision Source culture of best practices, it brings to mind something that echoes in my mind all the time with regard to business, which so many doctors have said to me from the Vision Source Network, is what you can measure, you can improve upon. I've heard that time and again from this group. And I'm wondering, in this time, as you're grappling with all those issues, what are you measuring? Are there 3 components that are the key performance indicators to coming back, or are there 2? Is there one significant one? I'm curious how you might answer that.
Yeah, absolutely. I think that all of us, including Laurie, will tell you the first measure is just the way the patients are responding. So first you want to know is, what is your book rate, right? If you're limiting your number of slots, you better make sure you're filling those slots. And what is then the capture rate, right? We want to know that we are taking care of every need of our patients every time. And that is an important measure. So how are we capturing their needs and the products and services they need? And then the last is, we have to look at revenue per patient as an indicator of how well we're performing in this awkward environment. Many of us are worried, can you still do well wearing scrubs and selling eyewear? What about with all the PPE on? Are we not personable, and are we not showing our personalities to our patients? And how will that impact our practices? So I can tell you we've been pleasantly surprised, because one of the things we've shared with the network is remind your patients that there's still a smile behind that mask, that we are still the same. What hasn't changed is our beliefs and our culture and our ability to be extremely patient-centric and focus on them. And that has yielded great response from our patient base. And I think that's true across the board from our membership.
Wow.
Thank you.
Spoken very profoundly. Yes, absolutely. Amir, I know Eric was sharing with us all the different things he's seen around the country. If I'm to walk into your office today, what would be different than it was 3 months ago?
I think the most obvious thing is that we will greet you outside. We'll make sure that you have been given all the information that you need. You walk into plexiglass and PPE, and that's about the extent of it. I think you'll see chairs maybe spaced out, but I got to tell you, the way we approach patients, we know who they are already. One of the advantages of being ready for them is that we greet them by name and we smile. We make sure they know we're smiling, and the rest of the care is they are floating through the practice better than they ever have before. Honestly, I think we go above and beyond the call of duty now to make sure they're comfortable.
I had to smile at that, because I think historically that's been one of the real advantages of optometry. We've had those personal relationships with our patients, those very unique, I think, in many ways to our profession. And I think at a time like this probably works to our advantage. Great practitioners like you, Amir, who build those relationships long-term with your patients. I think no time better than now. It's about trust. It's about, relying on each other to do the right things. And I think it's just such a key element to the relationships optometry has built. So, Donna, maybe you can talk a little bit about also what types of activities, sort of what's changed from more of the global Vision Source area, what adaptations Vision Source has made, any changes you have done or made to adapt the business for all that is going on in the world today.
Right. As Amir said earlier too, we all had to adapt, right? We had to make changes to how we were doing things. We had priorities on our plate at that point in time. So we had to shift our priorities around to make sure we were meeting the needs of our members versus what we had perhaps planned. I think the biggest thing, as I have oversight for the vendor relations side of things, I think the biggest thing was we didn't have these type of vendors in place, right? We didn't need PPE before. We didn't need masks. We didn't need the plexiglass things. And so it was evaluating all sorts of new vendors to make sure we were getting our members' needs. So they would say, hey, Donna, we need this or we need that, and we'd investigate. And obviously what we had to do as well is ensure that those we were working with, we've all heard about masks that are really not protective. They're letting 99% of the particles come through versus blocking 99%. So we had to really make sure we were evaluating these vendors for their efficacy, that they were very high quality products, that we were delivering to our members, but yet at a very good price. So I think that was a big adaptation for us. We probably brought on more new vendors in the past 60 days than the past 2 years just to fill the needs of our members.
Wonderful. Yeah, Jeff, just a quick question for you, and maybe because you have a sort of global picture of this. We've got a lot of employees that are out of work, that are furloughed, et cetera. Do you have any sense, as you have this more, universal picture, international picture, national picture, as to how things are going with regard to demand? Are people coming back? Are we seeing the volume ramping up in a way that we'd like to see? And perhaps, Amir, you can comment on this as well. And maybe, Eric, we can even get some sense for Dr. Sorenson as well. But Jeff, we'll give you a first crack at that. What are you seeing in terms of the lift? We do see some data out there, but curious in terms of the Vision Source network.
Yeah, so kind of two questions in there, Howard. So if you look at it globally, obviously with our strategic partners who are global companies, we have the luxury of seeing where the pandemic was prior to coming to the U.S. And quite frankly, they're just further along in the process, if you will, than we are. So we do have that lens, if you will. And I would say globally, we're seeing in the U.S. what kind of played out in Europe and in Asia is demand will come back, and the patients will come back. And when they come back, they'll certainly be concerned about their safety, obviously, first and foremost. But they'll buy and they'll purchase as well. And we're seeing that in the U.S. for sure. As Eric said, I mean, what's going on in Boston, Howard, as you were alluding to, is different than what's going on in Austin, and people are even within the U.S. are further along in that process. But we're very encouraged by what we're seeing when things begin to open up. Although the volume is not there for both throughput challenges until doctors begin to find their processes a new way, and hopefully that will be able to increase over time in a safe way. But we really have no concerns for the demand long term.
That's very encouraging. Amir, can you talk to us about on the ground a little bit what you're seeing, how quickly have things started to ramp back up, and how you're trying to address that?
So through the many conversations I've had with colleagues, the one thing I've learned is that while many are operating at 70% or 65% of traditional volume, the revenues are near 100%. In fact, that's true in my practices. So what it says is that obviously the patient coming in, it has a demand, it has a need, and we are meeting that need well. So the good news is that lower volume, better revenues feels great, but I assume that's pent-up demand. I think that it may slow down a little bit as we get back to the norm. But at the end of the day, we start to ramp up our volume back to normal. And most practitioners have been very positive. I know I've spoken to practitioners around the country who said they were very optimistic about patient behavior and their safety and feeling good about the new norm, if you would.
That's really encouraging to hear. I mean, what does the future look like in your practice, Amir? I mean, the things that you're doing now, I suspect those will continue. I mean, you're talking about the new norm, so I know that's a term that's been used a lot, but what does the new norm look like in Amir Khoshnevis' practice?
Yeah, actually, could I add to that too, Howard, and also sure. Ask if there are particular, along that line, are there particular new programs that Vision Source is looking at in terms of either virtual try-ons to save time or communications and telemedicine? Like, what are the new tricks? What are going to be helpful?
Yeah, I think that's a great question because the new norm, one new norm is that we're so comfortable in video now. A year ago, if you said we're having this interview, all of us would be breaking out in hives and not comfortable with it. But today, this is just the way it goes. So we actually now have 4 slots per day for telemedicine visits in my practice per doctor. So we actually are seeing, we used to see 0, now we're seeing 4 a day, right? And that's just the minimum. And then we at Vision Source have been on a path for 2 years now of discovery with telemedicine and teleoptometry, and I differentiate those two, a different conversation. So we were very prepared, and I think our doctors were much more likely to say, I need this and I need to jump in because they had learned about our progress and due diligence in getting to this point. So we had the vision that telemedicine was going to be a big part of optometry, regardless of whether we liked it or not. So we wanted to make sure we shaped it and helped shape it for private optometry. But today, we are working with several vendors to offer our members as many options as they would like, as complex or simple option as they would like in teleoptometry. We are working with vendors to make sure that our doctors can do a lot of testing more mobile than they were before. How do you move certain medical testing to a headset versus a stationary object? How do you make sure you can do in-home visits and in-home care, continuous care, versus what we've done in the past? And so we're building the best practices on that. We have a team of really gifted optometrists who are all investigating this. So the future is bright as far as I'm concerned. And honestly, I think the new norm brings challenges in the past become new innovations, and obstacles in the past become a new way of thinking for optometry. So the silver lining for me in my practice and many others I know is that we've lifted that old guard of new and different is bad. I think most of us are looking at it today as how does this assist patient care?
Yeah, Amir, I think the silver lining is something we're all looking for, that's for sure. And telehealth certainly could be one of those big opportunities for us that comes out of this. As we start to wind down, maybe just a couple more questions for you guys. And then Eric, please feel free to interject here anywhere. But you guys have had a lot of experience. Maybe we'll start with you, Amir, on this one. Lessons learned, things that mistakes to avoid. I mean, we all make them, especially in a time where there's no real playbook to open up to see how you follow, right? So any suggestions, thoughts you have for our colleagues on lessons learned for you during this crisis?
One lesson I think that really comes to mind initially is communicate more, not less. I think that one of the things that I learned throughout my entire personal and professional life in this experience was when I had the moment to really communicate well and to connect with people, we found peace. We found some solutions. But when we were afraid and we hid, it only caused more chaos and more confusion. I can say that about my staff. I can say that about my relationships in personal life. And because we were so busy, focused on saving everything, that sometimes we just didn't communicate well. And so, leaders need to communicate at a time of crisis.
Boy, is that true. No question about it. And it's not easy. It's easier not to commit and to have the words to say that people are going to hold you accountable for. And so there can be this tendency to want to sort of retract a little, but couldn't agree more with you. We're going to make some mistakes. We have to accept that. Again, there's no playbook for this. We're going to stumble here and there, but we got to keep those efforts going. And I can agree more with regard to the communication. Donna, Jeff, maybe as we start to kind of wrap things here, lessons learned for you guys from more of the corporate, from the home base there. I know Amir's part of it, but he's out in the trenches as well. What have you guys learned or best practices you could share that might be helpful to our listeners? Well, Donna, why don't you start?
We both chuckled when Amir said communicate more, because that was both of our answers. So it wasn't fair that Amir got to go first. But I think more, and we did. I personally made some mistakes, and I think with that is also the other side of the communication is listening and ensuring we're listening to what our members were needing from us, and not following our own agenda. Like, we might have thought something was what they needed, but I think the important thing was to be there to listen to what they really needed, not maybe what we thought was best for them. So, and it goes right along really with that communication piece, right? It's that other side of the communication, listening and listening effectively to make sure we met the needs of what our members really wanted.
Fantastic. And Jeff, for you, anything to add?
Yeah, I mean, two words kind of stand out to me, and you can't listen and you can't communicate if you don't have people to listen and communicate with. So this isn't a plug for Vision Source, but community is the fabric of who we are, and don't go it alone, and be a part of a group of colleagues that you trust, that you can learn from, that will push you to not stay in a comfort zone. That you can have spirited disagreements and work through things and get better, right? That's what it's all about. And then flexibility, because if you're not flexible in this new world, then you're just going to probably not be happy. So get flexible if you're not flexible already.
That is for sure. No question about that. But thank you for that. And thank you for what Vision Source continues to do in support of independent optometry. Before we say goodbye to you guys, we have a tradition around here that we always ask our guests if they have anything to share with regard to any recommended readings or references that they might suggest for folks that might be helpful during a time like this, or just anything that you think could be constructive. So Donna, will go ladies first. Anything you've been looking at or have looked at lately that you think would be helpful for people at this point in time?
Well, I'll be very honest. I did not start reading this book, but I just received a recommendation for a book, and the title to me was very appropriate for this time period. So it's called Doing Agile Right. And I think it kind of goes right to what Jeff said, right? If you can't be flexible, if you cannot be agile right now, I mean, we all have had to do that. That's kind of what we've talked about a lot today, right? Is our ability to be agile. So haven't read it, but I plan to. And I think that just based on the title, it sounds like something that we all should probably take a look at, because we can all continue to learn from it.
Absolutely. Very appropriate title for right now. No question about it. Thank you, Donna. Jeff, anything to add? Anything you've been looking at lately that you find helpful, or something you've looked at in the past?
I wish I would have had time to read over the past 60 days. I'm being completely transparent with you. All of the reading has been supporting our members and figuring out how we're going to help them be successful going forward. But, you know, Howard, the way you opened this call, I think, you know, I've been very introspective, and not to be too heavy as we're closing things up here, but I think, you know, anything that we can do to read and learn and be retrospective, if you will, on our unconscious biases, I think is critical. To your point, we're only going to get better as a world and as a community if we start with ourselves. And so I would just encourage anyone to study their unconscious biases if they've never done that.
Thank you, Jeff. And Amir, we'll give you the last word. Anything you're looking at or reading that would be helpful to the rest of us?
Well, I will reach to a book that has been so profoundly important to me throughout my last maybe decade or so, was Bob Berg's The Go-Giver. I think it's an absolute must read. It is a book that is written like a fable, and when you finish reading it, you will want to share it with everybody you know. But The Go-Giver foundationally is so important right now in this moment, that we are more open and more aware of others' needs than we are our own. And if we do that as a society, I promise you, we will live a better life. So if you haven't read it, that is an absolute must.
Wow. Thank you, Amir. I'm going to put that one on my list for sure.
Strong recommendation. I'm writing that down for sure.
Absolutely.
You got us all writing that one down. So before I kick it back over to Eric to interview our colleague, Dr. Sorenson, there in Austin, Eric and I want to thank you guys very much for your time with us. First of all, we want to thank Vision Source for the contribution it continues to make to our profession. It's significant. There's no question about it. The power in numbers, our ability to aggregate as independents is so critically important. So congratulations for the work you all do. Amir, your representation as an optometrist on that group is critical to us, and we couldn't have a better person representing optometry there, along with your other colleagues who represent optometry at Vision Source. Thank you for what you continue to do. Be well to all of you, and keep up the good work you're doing. It's important. We have to make a difference, both when it comes to the COVID issue, when it comes to racism. I know that Vision Source will continue to have a firm and strong stance on that. We appreciate it. We're here to work with you in any way we can. So thank you very much, guys, for your time this morning, and also for your insights. It's been extremely helpful. Thank you very much.
Thanks.
So Eric, bye guys. So Eric, we have an opportunity now to actually talk to one of my great colleagues, Dr. Laurie Sorrenson. You're there in Austin. Tell us about what's going on there, and hopefully we can hear a little bit from Laurie.
Yes, absolutely, Howard. It is time for that, and I've been looking forward to this interview since I learned that it would happen. And joining me now are Doctors Laurie Sorrenson and Dr. Eric Hammond. Welcome, guys.
Thanks for having us.
Thanks so much for being here. Let's start with you, Laurie. Tell us about this practice. Tell us about the journey from the beginning of the COVID-19 challenge and where you've taken things.
Okay, so Lakeline Vision Source, we have 7 full-time doctors here, including myself and my son, Dr. Eric Hammond. And we moved into this new building 5 years ago. So it's about 10,000 square feet, and we have 10 exam lanes. So when this hit, I mean, it's really been a kind of a quandary for us. How do we get back to where we were before? And it's been a really we're doing it in stages, step by step. So it's been a challenge.
What have those stages been like? I know a little bit of the background with how you, Eric, were holding down the fort, so to speak, in the early days. Give me a sense of that and how that came about, that you had a lot of action here very quickly.
Yeah, so we started with, we have around just over 40 staff members here when we're running full speed. And we went down to about 5 staff and 1 doctor, down from our normal 7 doctors with 5 at a time. So what we were able to do was be able to stay open with that skeleton crew and see medical eye emergencies, but also vision emergencies. So we were able to see those red eyes, herpes infections, which I saw a pretty big increase. Stress is a big motivating factor.
Sure.
Everyone was a little stressed during that time. But we're also able to see that -5, -6 person who was out of contacts and their glasses broke and they're 2,400 and can't drive legally,
Right.
kind of situation. So we're able to do that with that small skeleton crew. And then step by step, as we've opened back up, we bring more and more staff back until where we're at right now.
So just to give a sense of what you guys are all about, you really were one of the only open practices in the area. And from what I understand, patients from the surrounding area were just going through the phone book and calling anybody to see if they could get some emergency help. And you guys were the ones who could answer the call. How did you become that go-to practice here? And what is it that guides your philosophy to let you do that?
So I'm also the administrator for Vision Source in the Austin area, and I knew we had resources that not everybody has because we have a bigger practice. So we actually let the doctors in the area know that if you need help, if your patients need emergency care, we're here. My husband created, you'll see all the signage about all the stuff that we do. He's an artist, and he created all our signs.
They're fantastic, and I think we have some pictures to roll along.
Okay, so
yeah.
they're pretty cool. But he actually created signs for some of the offices with our phone number on it, so patients would actually text us or call us if they had an emergency. So a lot of doctors were available for emergencies to go up to their office, but we were actually open 9 to 5, so patients could just immediately come up no matter what was going on and have Eric take care of them, because he was here 9 to 5, Monday through Friday during this entire crisis.
So that comes back to communication again, and just having the right channels of information for patients and doctors both. What can you elaborate on that, either one of you, about communication and how important it is?
For the patients?
For everyone. Some of your Vision Source colleagues were also referencing the importance of communication at all levels. I'm just wondering where you might add to that, or what's been helpful, or what's been a challenge.
So I actually administer a listserv group within Vision Source, a couple of them actually 3 of them. And that communication has been huge for me. I feel like I've been helpful to create that and make this help with this platform to do that. But trust me, I got more out of it than I put into it, for sure. So that's been hugely helpful. With patients, we are over communicating, but right now, I think for staff or for patients, I don't think there is such a thing right now to tell them what we're doing, how we're being safe, what for staff expectations, what we've changed, because we've changed everything almost every single day.
Any thoughts on communication before we move on, or maybe we just want to move on to actually some other elements, which are tools. What are the new tools that we need to work with? What are you finding being one of the early open practices or the state open practices? What can you use? What do you need improvements upon?
Yeah, so one of our big communication things that is super helpful for us, especially if you're operating with a smaller crew, maybe you can't answer the phones quite as well as you used to.
I've heard that a lot.
Yeah.
Phones are an issue. Yeah.
Tell me about it. It was an issue before, and it's definitely going to be an issue during. But if you're able to find a program that works for you, is getting some kind of text message based system into your office. So what that allows us to do, so for ours, for example, we use Weave. So when we get a missed phone call, it shoots a text message directly to the patient saying, "I'm so sorry you missed your phone call. Text us back. How can we help you?" It doesn't feel like you missed the phone call when they get that text message back.
Right.
It's really weird. So before we had Weave, we'd get a complaint, I don't know, couple times a week, couldn't get a hold of you guys, yada, yada, yada. Ever since we've done the texting, even though we're still missing the phone calls, the complaints went way down. And I think they still feel like they're heard with that text messaging.
Right. It's like when you walk in somewhere and somebody addresses you when you're trying to order food or anything.
Exactly.
It needs to be acknowledged that you're there and waiting.
I'll be with you. Give me 2 or 3 minutes. I'll be right with you.
I see.
That's what that text message does.
Yep.
Especially during this time, if you don't already have that, I think that's pretty huge with your communication with your patients.
Right. And we've talked about virtual try-on and home programs for such that we want to experiment with and see if it can help ease the time in the optical and less touching of frames and less contaminants potentially.
I'd love to have a really good virtual try-on program. We were an early adopter of another technology about 5 years ago. Not quite what we needed. It doesn't work quite the way we need. But I heard you said something about there's some new technology coming down that sounds like it's going to work.
Yeah, I think
we'll sign up.
Yeah,
we're ready.
Good. Yeah, I think we can look at it after the program and see if it's something that would be a fit here. But in general, are you looking for, and I guess this would fall in that category, things that ease the strain on the optical or the friction of the patient flow? It seems to be that's where the money is, so to speak, because if you can ease the friction and have patients come through, you're doing more business more effectively.
It has been the number one challenge during this crisis is how do we take care of patients in the optical? We figured out the check-in process. We already were pretty good at that. Figured out all the safety disinfection things pretty quickly. But the optical, honestly, we are still tweaking things. We've created 4 mask-free zones. One's in the exam room, one's actually outside, and then 2 over in the optical in a corner. And figuring out how, because close contact now by the CDC is defined as less than 6 feet and more than 15 minutes.
Okay.
They just came out with that. So, and they don't define whether that's with or without a mask, which I think is weird, but they don't have a lot
There's lots of variables and lots of questions about all the guidelines of any
nobody
kind.
knows anything. So trying to get an optical experience where your face-to-face time with the optician is 15 minutes or less has been seriously a huge challenge. But I actually look at very positively because now we can work on our systems to make things more efficient. We get our history room and our prelim times with our technicians. It's seriously probably cut in half because we're doing online history forms. So we're doing all this really cool stuff. For me, that's exciting. It's
the challenge. It's taking the situation and trying to adapt to it in a creative way for better workflow. Right. I mean, that's spoken like a true entrepreneur. I want to ask Howard. Howard, are you with us?
Yes, I am with you, and I am learning every minute, as I always do, from Dr. Sorenson. Hi, Laurie. Hi, Eric. Good to see you guys.
Thank you so much.
Information
through me. They can't hear you, Howard, but I can hear you, and I'll relay a question, whatever you might have. But I'll tell you guys that Howard is saying that you guys are great friends, and he's glad to see you, and he's learning every minute from what you're saying. Howard, what would you like to know? Raising questions from that.
Right. So I have 2 questions. One is a little bit off subject, but I'd love to hear Eric's response because I have worked in a family practice. You can mention that to Eric that I worked with my father. Does his mother listen to his advice?
With his father, and does your mother listen to your advice? Is that the question?
That's the question.
Can we do this off air? Is that
he wants to do it off air.
I don't need that on camera at all.
Okay. Well,
I only ask.
So,
I only ask because I was asked that myself 100 times.
He was asked that himself. What's your second question, Howard?
So my second question is, Laurie and Eric have mentioned a lot about patients and making them feel comfortable. I'm curious about what they've done for their staff, what they've done inside the office to continue to make their staff feel comfortable coming to work.
Sure. He's asking about the comfort level of patients, and you've done a lot around that. But what about the staff? You have another constituency here. I think you said 40 some odd people work here. What have you done to help them be comfortable working and be ready to go?
Yeah, that's my number one priority, just to be honest, is not just safety of the staff, but they feel safe. So there's been some things that I think that we could back off on and do a little differently. I actually am doing anonymous surveys now so that they can speak up, because that's a struggle for them to speak up to me because they want me to be happy, right? Sure. I know they want me to be happy. And so I've done anonymous surveys to find out if they're comfortable backing off, and they weren't. And so we're still doing everything exactly like we did on day one, plus all the other stuff we added on. So they're safer here. And I've told them, and the other thing is to over communicate, right? And I say this, you're safer here than you are anywhere else because of all the things that we've done and all the things we're doing to protect you. And we are sticklers about keeping a mask on 100% of the time. So I know they're safe. I just have to communicate to them that they're safe, and I have to give them a form to tell me what makes them feel safe.
Well, it's well said. It seems to me that everybody here is a strong and well-oiled machine. I've learned about the distance you can put between you and the patient with regard to exams and gathering their health critical key points, and then the workflow here. We'll put together a report, Howard, on some of the details here. I think that's definitely in order to outline what's been happening here at Lakeline Vision. And we can look for that in the coming days on InsideVision. I want to thank you guys both for your time and for allowing me and my crew here to learn from you and share that with the optometric community.
Thanks for coming, guys. Appreciate it.
Yeah, and Eric, please offer my appreciation as well. And tell Eric if he wants to talk to me, I'm happy to talk to him later about how that goes with your parents. But anyway, thank you, Eric. Very insightful.
Certainly.
And, it seems clear to me that communication and caring are those two things that came out of today, listening to people who really care about their customers, care about their patients, care about the people who are part of their network. It's a pretty powerful message. Thank you, Eric. I think that was really helpful. And Dr. Sorenson and her son, it's wonderful to see that collaboration and how they've managed through it. And I hope it's inspiring as it is to us. I hope it's inspiring to those who are listening as well. So thank you, buddy. With that,
I'll pass that along. Yes.
Thank you. So with that, we'll thank everybody for listening today. Wish you the best. Be safe. Be caring about each other. Let's make a difference out there. And before we say goodbye, we're going to turn it to Dr. John Rampakis for another episode of Something to Think About. Have a great rest of your week, everyone. Take care. Thanks. Take care, Eric.
So long. Thank you, Howard.
Thanks, everyone. The last financial crisis we had was about 12 to 13 years ago. However, it didn't affect everybody like the current crisis caused by the COVID-19 virus. This one affected everybody indiscriminately without bias. It hit everybody because we had the mandated closure of all non-essential businesses. Independent optometry has been the backbone of our profession forever. It's changed a lot in the last decade, for sure, with the creation of a lot of affiliated networks. These networks have been very, very popular to join, sometimes for price, sometimes not for price, on being able to get products. I've had the privilege of working with Vision Source and other affiliated networks of independent practices for nearly 20 years. And a couple of things I can tell you. First and foremost, each one of them has a personality. What word comes to mind when I think about Vision Source? It's easy. Family. And I can tell you the power of that family is pretty formidable. They have the resources to help people with experts coming in, with financial help. It was interesting during this recent crisis, the group of independent practices under the Vision Source banner didn't have to deal with this crisis on their own. They were able to draw from the strength of their brothers and their sisters, if you will. And the power of that family is pretty formidable. Look, at the end of the day, patient demand is going to come back. Normalcy is going to return. But I think there is a scar left on our psyche, right? When the next crisis comes around, do we want to deal with it on our own, or do we want to be able to draw upon resources much larger than ourselves? Do we want to be able to reach out to our brothers and sisters, our family, and draw on the power that they have? My name's John Rampakis, and that's something to think about.
Thanks for watching Inside Vision. To receive updates about our programming, click subscribe.